Hello everyone, it is my pleasure to introduce Dr. Yash Chandwani. He has secured a rank of 295 and he is our test and discussion student. Congratulations Dr. Yash.
Thank
How,
you so much, sir.
how do you feel today?
Very happy, sir. Very relaxed, very relieved even.
Okay, so तो आपने तो TND student रहे हमारे तो how was your journey with the TND? How did you prepare yourself? So you told me that you took TND in internship year, right?
Yes, sir.
Yeah. So how was your journey with the TND? What did you do?
I started slowly. When I took the TND plan, I planned to start with each subject, complete one subject once, give a test, and then go with the discussion. I did not go with the schedule given by the TND because I already had to manage internship and TND also. So I made my own schedule. And whichever pleases me at that time, that subject I completed first through my main notes. Then I gave the test of the test and discussion. And then during the discussion of that TND, I only watched the part where I was confused. The question I have marked during the test and discussion that were confusing me, that were incorrect, that were guessed by me. That only part I watched during the discussion. And so that I brushed up the discussion part quickly because the topics that I already know, I did not wanted to give a lot of time to that because internship is very hectic during that time. So I did not want to invest so much time in that discussion part of the videos.
Okay. तो do you remember anything from TND which changed your approach totally ऐसे कुछ या मतलब ये तो game changing था kind of a thing you remember from TND or from anything in your last 1 year?
Yes, sir. I think some parts of TND changed the lookout of a particular subject for me. Like the way I was doing Obs Gynae, the way I was doing radio, it completely changed after I see the TND discussion because the way I was approaching the topics was different. And after looking at the TND, my approach changed and that helped me in answering the questions more easily, saving more time, making charts that how to differentiate between similar things. And so that was overall easy. Overall, the content was the same, which I already know. The pattern in which it got discussed, it was different and it really helped me.
And DAMS also had many other sessions like DVT, CBT, Grand Test, ये सारे और PYQ, PYTs, what all you used out of all this huge
Uh,
buffet that we have?
yeah, it's really a huge buffet. I used DVT a lot during the end part of my preparation. DVT helped me in completing smaller topics faster so that I can have multiple revisions about that, like a few image-based topics like ortho, derma. I did it twice, thrice through DVT in like 3 or 4 days. I was able to complete 3, 4 minor subjects from DVT, and uh, I revised it around 3 to 4 times so that it stuck in my mind. So to condense things and to revise multiple times, that's where DVT comes into play for me.
Okay, so you just finished your internship in this April.
Yeah.
So what advice would you like to give it to your juniors, those who are starting fresh in internship? बहुत सारे लोग ऐसे होते हैं कि in their whole of MBBS they would have haphazardly prepared and they want to start fresh in their internship year. What would you recommend them?
I think there will be different type of groups of students. One who have done well during their prof, they have studied something at least, and one who will be starting from zero in internship. So I did good during my prof. I developed my basics so that I had one set of notes when I entered my internship. But if someone is starting absolutely new from internship, they should stick to the basics. They should at least complete one set of notes by the midway of the internship. At least complete everything once and then go on to revision. And I would say internship is different in different colleges. Somewhere it is hectic, somewhere it is quite easy. So you have to choose your battles there. In some departments, you can't study that whole day in that income. Like obviously any labor room you're on duty, any night duties, and emergency duties. So do some questions, have at least 1 to 2 hours of QBank or some quick brush up of the notes. So consistency is important, what I'm trying to say. At least 2 to 3 hours a day if you do for the whole year, it will stack up to a big thing at the end.
So for all those current interns who are listening to him, what he said was, just to brush it up in one sentence, if you have already started, he did pre-foundation and foundation in second, third year and final year. So for him, TND helped. So if you have not done your notes, you have not made notes, then it would be better. You should be taking something like a regular course, which will help you build up your concepts and the notes. If you already have made notes, then better take a test and discussion. That will top it up for you guys, right?
Yeah. Yes, yes.
And what about CBTs? Did you give CBTs?
I was not able to give CBTs because of the time crunch.
Okay. But grant tests? What
Yeah,
about grant?
grant test I gave. It was all about the number of corrects and number of incorrects you are getting. That decided my frequency of the grant test during the internship. At first, when I started, I was stuck between 130 and 140 corrects. So I gave my grant test around once every 2 weeks at the start of the internship. And then when I continued throughout the internship, when my scores were stagnant, I stopped my GTs. I looked what is going wrong. Sometimes it's the PYQs that needs more revision. Sometimes I am in marking answer wrongs from the PYTs. So I stopped my GTs for around 1 and 2 months. I completely did my PYTs again. And then again, once every 2 weeks, GTs. Then my score increased from 140 to 150. And so that during the end of the internship, I gave GTs at a frequency of around once every week. I was giving it till your score is getting stagnant. Once your score is getting stagnant, there's no point in giving multiple GTs again and again. You have to find out what's going wrong. So that's what worked for me.
Okay, that's a good strategy. You keep giving GTs whenever your scores are getting stagnated. Start looking inwards. What is going wrong?
Yes, yes. Sometimes it's PYTs you are marking wrong. Sometimes it's minor subjects. Sometimes it's image-based questions. Sometimes it's factual information. So every time the GTs will give you the answer what's going wrong. So you have to stop giving GTs multiple times when your score is stagnant. So that's how you will improve. That's what I figured out.
Okay, so Dr. Yash, what are your future interests? Which subject you want to pursue?
With this rank, I think I'm grateful that I have many options open, but I'm convinced with MD medicine at this point.
Okay, so that's a very good branch, by the way. So from DAMS family, I would like to congratulate you again and also wish you best for your future endeavors. Thank you. Thank you very much.
Thank you, sir.